Hello, I'm Dr. Jay Harness, and welcome to the introductory video for Andrea Leonard's Cancer Specialist Exercise Training. I want to take this opportunity right at the beginning of the video to congratulate Andrea for the kind of pioneering work that she's been doing. And this whole concept of taking health fitness professionals like yourselves and giving you additional training to make you legitimate specialists in the care and treatment of cancer patients. It's a unique program that she's created. I've gone through the modules. They're really outstanding. And in my world of breast cancer, people like you are really needed. Well, a little bit about myself. As I've indicated, I'm a general surgeon. I've been in practice for 44 years. I did medical school and residency training at the University of Michigan, and then remained on the faculty at Michigan. And in the mid-1980s, we created one of the world's very first multidisciplinary breast centers. And what we quickly learned in that effort is that it really takes a team of people to treat breast cancer patients. We're not only talking about surgeons and medical oncologists and radiation oncologists and pathologists and radiologists and psychiatrists and psychologists, where we're talking about people like you, health fitness professionals. Your role in the overall picture and treatment of cancer patients, in my view, is vitally important. Now, what are the benefits of exercise? You know what the benefits are. You're an exercise and health professional fitness person. I don't need to inform you about the benefits of exercise. They're well known to you, and those benefits are well documented in the medical literature and also in your literature. Now, if we look at the role of exercise at different stages along the way in my world of breast cancer, as soon as I see somebody who's newly diagnosed with breast cancer, I begin right there on the spot, emphasizing the importance of mobility, moving around, exercise, if you will, getting in shape for the treatments that are about to follow. I also initially refer my patients in the hospital settings that I'm in to physical therapists so that they're already interacting with a fitness personnel person. And also, when we think about the potential for lymphedema, it's important that they be in the hands of a qualified physical therapist who's been trained in the prevention and treatment of lymphedema. So we want to, if you will, get people ready for surgery, chemotherapy, radiation therapy by beginning right from the beginning and getting them fit, getting them moving, getting them exercising, working on range of motion, whatever it may be. Now, as we get into let's say the surgical treatment, if you will, exercise is really important. And here it's critical that you be working with the breast surgeons or the surgical oncologists or the plastic surgeons that you're going to be dealing with in your environment. And tailor making at the different steps along the way, the kind of programs that work for them to get your patients moving, working on their range of motion and getting them feeling empowered and getting them having better self-esteem. So it's really important that during treatment, that exercise be a component of the overall treatment approach. It boosts the immune system, it boosts energy, it boosts self-esteem and gets people moving. But again, work with your individual providers as to how you're going to specifically tailor make individual treatments. And all of this, of course, will be based on the information that you'll be getting from Andrea, but then you want to tailor make it to the providers that you're working with. Now, in my world of breast cancer, we have all sorts of different surgical procedures. We can do something as simple as a lumpectomy and an axillary procedure to sample the lymph nodes. There's a real tendency on the part of patients after having their axillas on to walk around like they're in a sling, not moving, not doing range of motion. And it's important that they comb their hair, swing a tennis racket, do circular motions of the shoulder to keep the shoulder from freezing up. As we progress on with the kind of surgical procedures that I'm involved with, which typically is a mastectomy then, the mastectomies can be without reconstruction. We then want the flaps down flat on the chest wall to make it easier then to wear a prosthesis in the bra. And many times we'll extend the incision laterally so that we get rid of the redundant extra skin and fat out in the axilla, which really bugs patients after the breast is removed and they see all that extra tissue. So the skin incisions can be, 14, 15 centimeters or more in length. Short term, there are drains in place. And those drains are really important to get the flaps to stick down because on the underside of the flaps, there's natural serum being created. How about then, what about reconstruction? Working with a plastic surgeon, this can involve an initial tissue expander or a direct-to-implant. More and more, the expanders and permanent implants are being put in front of the pectoralis muscle. So you need to know with your plastic surgeons whether they're retropectoral or in front of the pectoralis muscle. When they're retropectoral, the origin of the pectoralis muscle is disconnected and bridged with alloderm as a way of bridging and holding the gap and creating a pocket. And so the progression of exercise has to be tailor-made with the plastic surgeon that you're working with. And typically there's very little other than the range of motion of the shoulder that's done until the drains are out. Now, if we want to go to really major league reconstruction, then we're talking about rotating tissue. Typically, these are tram flaps or deep flaps coming off the abdomen, and so we have to deal with the surgery on the abdomen as well as a big rotation of a flap up into the chest wall. Most patients are in binders after the tissue has been moved out of the abdomen. This often is just the subcutaneous skin and subcutaneous fat, but may include muscle. So there may be weakness issues, there may be balance issues, there are a variety of things. Andrea is going to go through the details of these, but ultimately you want to be working with your local providers to find out exactly what they're doing and how they want you to help progress the mobility of the patient's range of motion, et cetera, et cetera. What about survivorship? For me, at least, I think exercise is part of the survivorship program of any cancer patient, whether that's a breast cancer patient, prostate cancer, colon cancer, doesn't make any difference what. Exercise is really vitally important. While we know that obesity is a contributing factor to the development of breast cancer, we also know that remaining obese contributes to recurrence from breast cancer. So that any program that you're going to be doing when it comes to exercise, we should also be working with dietitians and others to do the best we can to get patients down to a more ideal body weight. And exercising regularly is vitally important when it comes to long-term survival, and the data on that is really quite clear. Also, the data has been very clear when it comes to the prevention of cancer. The more ideal patients are in a regular exercise program, ideal body weight, while it's not a guarantee, they're certainly going to be lowering their chances of developing various forms of cancer. Now, one of, I think, your important roles is empowering patients. You're giving them a feeling of well-being, a feeling of control over themselves. And so think about yourself as somebody who is empowering patients as part of your effort. Also, I want to share with you a couple of resources that I've been involved with over the past few years. One is a social media website called Breast Cancer Answers. The website is breastcanceranswers.com. It's an all-video social media site. We have over 1,300 videos on the site on all aspects of the treatment, survivorship, prevention, you name it, we've got it in the form of understandable videos. 1,300 of them, as a matter of fact. Since we launched in 2011, we now have over 11 million views of our videos. We also have over 11,000 subscribers to our website, meaning that as we upload new videos, those videos automatically go to those subscribers. You might want to consider being a subscriber so that you get our videos as they come out. Let me also share with you another resource that when it comes to my world of breast cancer, trying to get this into the camera here. There we go. This is called the Breast Cancer Answers book, Your Guide to Achieving Emotional Reconstruction. This is the only book that I know of that's co-written by both a physician and a long-term layperson breast cancer survivor. In fact, Phyllis was a professional medical writer. It really outlines the entire journey that's involved with the diagnosis and treatment and long-term recovery from breast cancer. It's been highly rated. The little gold star that we've got there at the bottom, we were a finalist in a national book contest when it came to resources in cancer. All of the folks who have downloaded it, patients that I've given it to, love it and have given it 5 stars. And we're really appreciative of that. As I think I indicated earlier, I have reviewed the outline for the course that you're going to be dealing with. The amount of work and effort that Andrea has put into this is truly spectacular. As I've gone through the detail of those modules, I can't think of anything else that needs to be covered. It will give you the framework that you will need to not only deal with your patients, but also then be able to deal with the surgeons, the medical oncologists, and others that you'll be working with. And also stimulating those physicians to make sure they have referrals coming your way. Remember this, you're pioneers. The work that Andrea has done is incredibly pioneering, and you're pioneers as well. I like to think that I've been a pioneer in many of the things that I've been involved with. I've often joked that I've spent a lot of my career with arrows sticking out of my back because I've gotten things early on. I've been out front, and I found that people are shooting at me by being out front. That could happen to you. Hang in there and stick with it. Well, as I wrap this video up, I want to wish you good luck and all the best. I'm Dr. Jay Harness. It's been a real pleasure to be invited to do this intro video for Andrea. And good luck as you go through the Cancer Exercise Specialist training. Here's wishing you all of the best.